have received at least one dose of the COVID-19 vaccine. This amounts to over 65% of our total population. And as a result of our vaccination efforts, our communities are safer, and the majority of our residents now have access and have life-saving protection from the COVID-19 virus because of the vaccine. But over the past 2 months, we have also seen our case rates and hospitalizations continue to climb as the Delta variant spreads throughout our communities here in Baltimore County. This rise in cases puts our most vulnerable at risk, especially our children under 12, who are not yet eligible for the vaccine, and many of whom are now back in our schools 5 days a week. With these case rates climbing, I declared a state of emergency for Baltimore County to give our administration additional tools to combat the spread of the virus and to support our responses. Last week, the County Council voted to approve and extend that state of emergency, and I want to thank those members of the County Council who recognized the need to keep our residents safe and who supported the extension. Since that extension, our case rates for COVID-19 have grown only higher, and we have a significant rate of transmission in our community. And with regular calls along with area hospital leaders, they continue to express their concerns about the increasing case rates and their capacity to care for those who are contracting COVID-19. So while we are making considerable progress together, the rapid and ongoing spread of the Delta variant demands that we take additional action to stop the spread and protect the health of both our employees and residents alike. In local government, our work regularly brings us face-to-face with the people we serve. As such, our employees are at greater risk of contracting the virus in addition to spreading the virus to fellow employees as well as the communities we serve. We have a responsibility to protect the health of our employees and our residents alike. That's why today we are announcing that we will soon require Baltimore County government employees to show proof of vaccination status. Employees will have until October 15th, 2021 to submit proof of full or partial vaccination or submit a waiver request for medical or religious purposes. Employees who choose not to be vaccinated or who have a approved waiver will be required to test weekly and submit those results. As always, our labor representatives are important partners in our work here in Baltimore County. So, as we implement this new requirement, we are actively engaging with productive conversations along with our employee representatives, and will continue to bargain with them as we finalize the details of this policy. To be clear, vaccinations are the best pathway back to normal, and they're the best option we have to keep our kids in the classroom 5 days a week. The vaccines are safe and they are effective. We know they work. So I likewise want to applaud the Biden administration, who I understand will be making a similar announcement related to employee vaccinations at the federal level later today. I urge all residents of Baltimore County to get the vaccine if they have not already done so. We have and will continue to lead by example in Baltimore County. And as we ask our employees to get vaccinated, I likewise encourage our businesses in Baltimore County to ask the same of their employees. I ask the state to ask the same of their employees, because public health is a shared responsibility, and we can only put this pandemic behind us if all of us do our part. In addition to today's announcement on employee vaccination, this morning I signed an executive order that also ensures our restaurants can continue the outdoor dining that we authorized last year. During this pandemic, restaurants have found success with outdoor dining, which is a safe way to mitigate the potential spread of COVID-19 while continuing to serve their customers and remain open. Outdoor dining was originally set to expire this week, and my executive order extends outdoor dining for the duration of Baltimore County's state of emergency, 45 days following its expiration. As the Delta variant spreads, we will continue to ensure our restaurants have all the tools they need to serve their customers and to do so safely. As we have in the past, we will expedite permits as quickly as we can, in addition to waiving license fees for outdoor tables. I want to thank all of those in our restaurant community for continuing to work with us to keep our communities safe. Together, we've made tremendous progress, but we still have so much more work to do to put this pandemic behind us. And we know the best way to do that is to ensure that all of our residents get vaccinated. So I look forward to continuing our work with the community to vaccinate all of our residents as quickly as we can, to get our employees vaccinated here in Baltimore County, and to partner with our business community to make sure that we can keep them open while safely serving their customers. I'll now introduce Stacy Rogers, our administrative officer, who can speak to some more details and the implementation of our vaccination plan for employees. And Dr. Branch and all of us will be available for questions following that.
Thank you, Mr. CE, and good morning, everyone. Our movement toward mandatory vaccinations is another step in our effort to address the COVID-19 pandemic. Today, we join a number of surrounding jurisdictions who have also implemented similar vaccination efforts. Government is leading by example. Workplace health and safety are shared responsibilities. We remain committed to providing a safe and healthy environment for our employees who work in and members of the public who visit or conduct business in county buildings and facilities. These requirements are added measures we are taking to help address and reduce the spread of the COVID-19 virus. The CDC, Maryland Department of Health, and Baltimore County Department of Health all agree that vaccination is a proven safety measure to help limit the spread of COVID-19, among other safety steps, including wearing a mask or face covering and frequently washing hands. COVID-19 vaccination is safe and recommended for all persons currently eligible to be vaccinated. With the continued leadership of and guidance of our health officer, Dr. Gregory Branch, we're confident that we will be able to successfully implement these two additional measures. The Department of Health, health providers, pharmacies, and retail outlets throughout the county and the region will continue to offer COVID-19 vaccinations and testing. We remain committed to ensuring that all of our employees who wish to be vaccinated are able to do so conveniently. We are also committed to implementing the vaccination and COVID-19 testing process in an efficient manner that fully protects employee health and personal identifiable information. We are also, as the CE indicated, discussing these policies with our union representatives. I look forward to working with all of the staff as we initiate this effort in October. I'm happy to answer any questions that you may have. Mr. C?
I just wanted to make sure, is the policy you must be fully vaccinated, and you just said submit proof of vaccination. Is that fully vaccinated, and will the definition of fully vaccinated change as the FDA authorizes more EUAs or full approval? Is that a change in definition?
Well, with respect to fully vaccinated, in relation to our policy, it is that our employees have received, if they receive Pfizer or Moderna, both shots. If it is Johnson & Johnson, it would be one shot. That's what fully vaccinated means in relation to our policy.
And will that change, for example, Dr. Branch is stating that, yes, once the FDA gives EUA for the general population?
Exactly. So what's going to happen is the fact that as the CDC and FDA tells us that folks need to get the booster shots, then obviously fully vaccination would include the booster shots. Yes.
Then,
Yep, you're good.
all right. How many employees does this affect overall? Since everyone will have to submit something. And do you have an idea yet the percentage of the county government employees that are unvaccinated?
Currently, as of our data this week, a little over 61% of our employee base is vaccinated.
And the number of the county employees that this will...
All county employees are required to submit verification of vaccination. They will be required to submit. And we will do that beginning. They'll be able to begin to submit their verifications beginning October 1st.
And how many county employees do you have estimated right now? How many people do you employ who will have to submit some sort of proof?
The full workforce is a little under 9,000, little over 9,000 employees.
And does this include all types of employees, part-timers, contractors, and full-time employees?
It includes all of our full-time employees, part-time employees, with our contractors. These are the people who are actually employees of other entities. We are working with them because they're not, by definition, our employees, but we are working very closely. We will work very closely with all contract entities to request that their employees be vaccinated if they are going to be on site in our buildings.
Okay, let's share.
Oh, I'm sorry.
So the public schools recently trained nursing staff to administer rapid tests under certain conditions. Have you guys helped them secure these tests? And if so, how did you go about securing them? And how many are on hand?
I'll defer to Dr. Branch if he.
So, specifically in relationship to securing their tests, they were able to secure their own tests, right? However, as the health officer, we oversee much of the clinical aspects of school-based health. So we are clearly involved in working with the school system as it relates to not only the testing, but also all of the other health issues related to the students.
And was there a cost for the school?
Now you're going to have to ask the school system about the cost of what they've done, okay?
And one more for Kate, we'll wrap up.
Yeah, I'm so sorry. On the testing, will you accept an antigen test or a PCR test? And about 30 minutes ago, the news broke that the Biden administration is going to get rid of the testing opt-out. I'm wondering if that's something you hope to do, take a harder line.
Yeah, I mean, the first thing I'll say is some of these details will be negotiated with our partners in organized labor who represent a lot of our employees. So this is a partnership to both keep our employees and residents safe, but also do so in partnership with those who represent our employees. So we are bargaining around some of those details. The question on the vaccination status, just to be clear, the October 15th deadline that we're talking about is for at least partial vaccination. The full vaccination will come later for other employees. As it relates to your question about the Biden administration, this is about, we all share the same goal because we know it works, right? Vaccinations keep people safe, they keep them out of the hospital, they keep them alive, they keep our kids in school. So our goal today in announcing our requirement of vaccination or testing is very much aligned with what the Biden administration will be announcing later today. We have not had those discussions in Baltimore County yet. We're here to announce this today, but we'll keep working with our representatives of our employees to see how we can keep our employees safe, but also our residents. But this is our focus today and right now. Yeah.
All right,
Thanks,
you.
everybody.